What is naturopathic, or what are some of the basic principles of naturopathic medicine? To focus on prevention and education, and to use the least invasive techniques possible. And those are the core elements of any good wellness program. But it's, the way our program differs is mostly in the information that we deliver in the course of our programming. So an example would be when an individual is identified to have high blood sugar. Instead of just sending them to a dietitian and saying just eat less sugar and make sure you get this many exchanges of different carbohydrates and take this medication such as metformin for your high blood sugar, we sit down with people and help them make changes with diet and physical activity primarily around typically what's called a low glycemic eating plan. So we not only reduce sugars, we reduce grains, we reduce potatoes, we increase fruits and vegetables. You can think of it as a modified Mediterranean diet. And it's extraordinarily effective. A recent study that I was just reviewing last night, they found a 40% reduction in the number of individuals with metabolic syndrome over a 12-week period using an intervention like this. Metabolic syndrome is a precursor to diabetes, and one of the elements of that is high blood sugar. So heavy focus on physical activity and dietary modification and counseling. We don't just give somebody the results at a wellness screening and send them out the door. We actually talk to them about what those results mean and the changes they can make and why they would want to make those changes to help them get well. There are about 2,000 employees that are eligible to participate in this program. And one of the things we're most proud of is that for the last 3 years in a row, the governor of Vermont has recognized this program by awarding it the top Worksite Wellness Award for large businesses. We're very proud of that. The second type of outcome we look at are clinical outcomes. So we show up every year and we measure things like blood pressure and cholesterol and height and weight and so on. And so we can measure changes over a year, from year to year. What we found is that in the first 3 years of this program, there has been a 30% reduction in the incidence of high blood pressure, a 36% reduction in the incidence of multiple risks for heart disease, a 32% reduction in the number of individuals who are physically inactive, a 50% reduction in individuals who are depressed, a 12% reduction in those who have excessive stress levels, and so on. Those are a few examples. Third area we look at are financial outcomes. And we estimate that in the first 3 years of the program, they've saved $660,000 in terms of direct medical costs, just shy of $1.2 million in terms of indirect medical costs, things like decreased productivity, absenteeism, workers' comp, disability, that are related to these health risks, for a total savings of about $1.8 million. And that's been a return on investment for them of $9.20 saved for every dollar invested in the program. The fourth area we look at are actual healthcare claim changes. And in the 3 years immediately prior to the program inception, they were having their healthcare costs were increasing by an average of 19% a year. In the 3 years since program inception, it's been 3% a year. And the last area that we look at is really the human side. And this is where we hear some of the most dramatic stories. And I'll just give you one example. An individual at a dealership in Montpelier, Walker Motors, very first screening he went to identified that he had high blood sugar. So we talked to him about what that meant, what he could do about that. And we told him he really needs to go see his doctor to confirm that he in fact has diabetes and get more assistance with that. So he did that. And I talked to him a few months later. And he told me that his blood sugar is now controlled with medication and physical activity. And he joked with me that he's his wife's new pet. She takes him on walks every night. And he said, you know, if I hadn't done the screening, I never would have known that I had diabetes because I didn't feel sick and I didn't go to doctors. And he told me that about the same time his brother, who also has diabetes, had just lost his eyesight from the diabetes. So he was feeling like he had just dodged a major bullet by finding out about this and making those changes early enough to have an impact.